All right, Dave.
All right, okay, good morning, everyone. So, bring you up to speed on what's going on with our coronavirus outbreak and our response here locally. So as of Friday, we stood up this incident command system through public health, and starting Monday, we started doing daily updates at 8:30 in the morning, so we're going to be holding those until this thing scales back down again. I'll give you a situation where we're at right now. I talked about this earlier. We're assuming, these are friendly assumptions. I'm not sure you have, yeah, you all have this with you. So we're assuming we're staffed, but we have an absence of one nurse, so we're down to 2 nurses. We have 5,000 N95 masks on hand. If the health officer is available by phone and email, and as of today, Mountain View Elementary closed for deep cleaning. Now, as far as the threat goes, coronavirus, COVID-19 is all, we're assuming, this is for planning purposes, we're assuming it's already in the community. We assume that the first diagnosed case will happen within 3 days. We assume that there will be 3 more cases in the 3 days following that. And we're going to assume that 1 case is in public school. The reason we made these assumptions in this way is so we can develop a plan that covers the most likely avenues that we'll have to be dealing with. Threat actual, we have 6 deaths in King County and Snohomish. Well, it's 1 in Snohomish, 5 in King County, 18 confirmed cases in King and Snohomish counties. Right now our mission is to lead the community in a community-wide response to the first cases of COVID-19 to contain the spread, ensure rapid response, and keep the public informed. Our intent is to conduct an assessment of resources and prepare for the operations plan, which happened yesterday. For the first 6 days, our focus has been on medical personnel, EMT, and preparedness. And that's where the county comes in. So the county is definitely big on our preparedness piece. We've been coordinating with Ross and his folks. We set up the incident command system, and this morning we expanded the incident command to include Sheriff's Office, MACECOM, Fire, EMT. So we have a much broader spectrum today, and that's going to continue through as we go into this incident command. So if you look at what is coronavirus, if you go to that sheet, this is a infographic that was produced by Seattle King County. It's a great infographic. It's very simple. It's easy to share with folks. And the answers are our most frequent questions that we get. So how has it spread? It's spread by breath, cough, and contacts. So like any other infectious disease, in this time period, right now we're at flu levels, high flu levels with influenza A and influenza B. COVID follows the same types of patterns. It comes in through respiratory droplets. 80% of people who come into contact and are infected will show mild or no symptoms. So that's something to stress to your folks. It's 80% of the folks are going to have mild or no symptoms. One thing you'll see in the news that skews those results is not everybody gets tested. So you'll have, for example, in Seattle, you have the 6 cases of death and only 18 cases confirmed. So it looks like a much tighter margin, but it's really not that. 80% of the people are probably not getting tested. So when you're talking to your staff and they're asking you, when should I get tested or when should someone get tested, I want to stress some things right off the bat. It's about hygiene. Okay? If they want to get tested, if they're feeling sick, have them contact their primary care physician, or if they're in some of the insurance companies have screening nurses. You can call or text or email your nurse through your insurance system, and they can help screen. What we don't want is a rush on the ER. So this group is perfectly placed to help tamp down some of the fear that's out there right now. And again, have the doctor screen. If the doctor says you need to go to the ER, then go to the ER. So we're trying to work out some of those same sorts of issues for EMTs, because EMTs get called to a location and then they have to respond. So then what is the screening criteria on whether to transport or not? This coronavirus, we are making the assumption that it's been in Washington for several weeks, and that's based on how the outbreak is happening in the Seattle area. Travel is no longer one of our key factors. We are going to ask about travel, especially out-of-country travel, but now it's beyond China, it's in Iran, has a large outbreak. It's everywhere. Iran, Italy, China, so we'll use those as an additional, out Frank, no.
Frank's got it.
So, we're using that as an additional screening criteria, but it's not the key criteria that we had 2 weeks ago. How do you protect yourself from coronavirus? Who's at risk? Those are probably our 2 biggest questions right now. I already talked about how 80% of the population is not going to feel, substantial illness. Who's at risk are the elderly and those people who are immunocompromised or have underlying health issues like asthma, COPD. Those sorts of things will suffer more than and are more at risk for death than healthy folks. How do you protect it? And again, this is really simple. It's about hygiene. Wash your hands. Like just Frank did. Cough into your elbow. Cough into a tissue. Throw the tissue away. Then we'll wash your hands. Avoid contact with people who are sick. If you're sick, stay home. It comes down to hygiene. I was asked in the lobby about, as a county and county offices, we deal with the public all day long. So, and we talked with Kelly yesterday, one of the things we have to start doing is, as departments, start washing down, and twice a day, start wiping down those public contact surfaces, doorknobs, handrails, countertops, things that people are touching. And if someone comes up to your station and they're coughing, as soon as they leave, clean it. So, and we'll get back with Kelly in a minute to talk about what supplies we have on hand. I did talk to the auditor's office yesterday. Did you get your stuff?
Yes.
Okay, so one of the things we looked at yesterday was the auditor's office is opening envelopes with ballots. So we got them masks and gloves to give them some PPE as they're opening that mail. They could come from who knows where. So looking at that. Okay.
Do we know if it's transferred by mail for sure and money?
We don't know. I mean, it's a new virus, and there's a lot more that we don't know than what we do know. I could have suppositions. I would like to see it like a normal flu, and as soon as the warm weather comes, then it would die down, but we don't know that yet. So right now we're treating it as if it's going to be a year-round thing until it starts its curve back down. In China, they're already starting to see the epicurve, the epidemiological curve has gone up, peaked, and started back down. So what we're going to have is sub-spikes down the line for the other countries. Okay, this one is a great one to have out for your folks. Just put it at your counter, post it. It's an easy to understand, and I don't know if it went around. It may look like that. So we have 2 different versions of it. This is the sheriff's office.
I like the pretty one.
Yeah, it's pretty what we have. But this one is designed for deputies to talk about when you're out on cases, what do you wear, what kind of PPE should you have on, and city will get this to you. Okay. Similarities. This will answer a lot of questions. Similarities of this flu and other influenzas. So let's kind of run through that. Both cause cough, fever, body aches, fatigue, sometimes vomiting, sometimes diarrhea. It can be mild or severe, even fatal. We lose people every year to influenza A and influenza B. So in Washington, we have hundreds of people lost per year. Transmission, we believe, is spread person to person through droplets in the air and from contact. COVID might be spread through airborne route. That's not been confirmed yet through the CDC. And apparently it can be spread by an infected person for days before symptoms occur. So it seems to be acting like pertussis in that it will colonize the nasal passages, and you may not be sick, but you can still transmit. So treatment, antibiotics don't work on either of these. It's viral, it's not bacterial. So treatment basically is fluids, Tylenol, Advil, stay home. So it's just treating like any other flu. Prevention, it's hygiene, and just anytime you talk to people, just keep pounding that message. It's hygiene, personal hygiene. Wash your hands. Kids wipe their noses, wash their faces. All those things keep people clean. causes, COVID is caused by one virus. The other flus we have a variety of flus, and that's one of the things we hear every year. Well, the flu shot isn't covering that this year. Well, flu changes and adapts every year. And how the flu is generally, the flu virus vaccines are done is we look at what's happening in Asia in the spring, and those are the versions we put in the virus or into the vaccines to go into the fall. So we watch what happens in Asia, make the vaccines for the next fall. This is new, there's no vaccine yet, they're working on it. I'm amazed that they have a test that's available this fast, and it's very impressive. The State Public Health Lab has gotten certified to do testing, and they can do up to 200 samples a day. So we're not having to wait over a week sending it to CDC. We can now send it to our own state lab, and I think UW is looking to open their lab to do testing as well. So we're going to expand our own capability here in the state. Again, transmitted similar ways. No vaccine. The cases I have under here in infections, that's the last, and that was, I think, as of yesterday. So death rate is approximately 2 per 1,000. The regular flu is 0.1 per 1,000. So it is more than the regular flu. So, Kelly, you want to talk about cleaning supplies? What people would need and what we have on hand?
We have gallons and gallons of cleaning supply. It's called a H2 Orange. It kills 99.9% of the airborne stuff out there. I have got in contact with our janitorial cleaning company. They are going to come by and just do our surfaces along with our regular cleaning, and then just hopefully our people themselves in their own offices, like you say, can wipe down some stuff. I am trying to get some Clorox wipe things, but they're harder and harder to get now. There's a lot of people buying them, and I've tried to get some masks, and they're sold out of the N95 masks. So it's definitely out there.
So in many ways, we kind of had a warm up for this 5 years ago with Ebola. So Ebola was a good exercise in that the hospital started taking a look at their procedures and really beefed up their infectious control plans. We did the same thing in public health. So in Mason County, we have 3 negative pressure rooms for cases. So if they go to the hospital, we have special rooms for isolation. There's a difference between isolation and quarantine. Everybody should be very cognizant that isolation is treating sick people. Quarantine is keeping people who have been exposed and not symptomatic set aside. So they're 2 different things.
Who would enforce that?
Health officer. So
Would we be looking at that if there was a case?
right. Right. So we're in constant communication with the hospital. When they have a suspect case, they call us. We walk through a flow chart and make a determination. If that person is ill with this, we'll react in one way and then start quarantine. Actually, it's a contact trace of all people they've had contact with, and start working getting those people into quarantine. Our goal is to get people into voluntary quarantine, stay home. Okay. Let's go over a couple other things. So we do have the negative pressure in the hospital, and we have negative pressure 1 cell in the jail. Is that correct?
1 cell.
1 cell. Okay. We did talk last week. Kelly and I talked about some of the ventilation plans, and the county's got some of the buildings have really good ventilation, and that we can adjust the outside air coming in and refresh the air more often. Okay. So planned actions for today. We had our daily update brief. We briefed county commissioners this morning. We're coordinating with North Mason this afternoon, and we're meeting with all the school administration this afternoon to talk about what it means for the schools. We had one school that closed yesterday for deep cleaning, and that's a method, but it only lasts until the next kid comes in with the virus. So we really want to stress hygiene with kids, because that's where this thing will just run around. Even though they may not be symptomatic, they can be spreading it. We're going to be updating the website and updating Facebook. We'll be staying on top of that and trying to stay on top of the messaging and keep it on target with hygiene and personal care. So, and if you're feeling sick, whatever, stay home. That is the other biggie. Okay, so I'm gonna go ahead and open this to questions,
Dave,
comments,
Dave, can you
concerns?
also, talk about Facebook and the email that's going to go out? That, so you guys are gonna update your Facebook,
Mhm.
and then you'll send an email out as soon as there's an update, so
Right.
that everyone else can share that email,
So-
and so that we can get the word out.
So, we set up a contact list for our COVID team, but when we update Facebook or update the county website, everyone will get that email. So we're gonna put it out to all county employees. So you don't have to keep coming and checking. As soon as it goes out, we'll let you know.
So I just wanted to know on the cleaning supplies and the cleaning people. So they're going to, I mean, how, are they coming daily now to do the surfaces? Or is it just,
They're coming their regular schedule at this point in time.
which is
I'd
like a
have
couple
to,
times a week or something?
depending on what building you are, but yes.
Okay, and then, so it really is falling on us to do the cleaning of the courtrooms and the offices and the bathrooms.
Then it's only good until the next person comes along.
So how do we get that H2 orange you were talking about?
I can get you some.
Okay, and it's just we mix it in a spray bottle
I
and,
will be pre-mixed.
and rags, paper towels?
Yes.
You don't use rags on anything, not anymore.
So we use the
PPE
brown
stuff.
paper towels?
You got stockpiles of anything that you're not letting? You got all the toilet paper, right?
I will
A couple
get you.
cases of dark beer.
It'll help me out.
Oh, all the Corona beer.
Corona beer,
Yeah.
yeah. No, actually, that's one of the biggest things, and Kelly hit on it. Amazon's had problems, people started doing the price gouging. Even for the squirt, hand sanitizer, 2 bottles of 16 ounces were going for $150.
Oh, my goodness.
They pulled them. Amazon did pull people that are doing that. They pulled them off, said, no, you're not gonna be selling it like that. You're not gonna be gouging people. So it is kind of hard to find some of the stuff. I was talking with Commissioner Netherland earlier. There are some stuff still out there in certain spots. Hit and miss if you find it, it's probably a good idea to grab it.
A friend of mine works
Won't be
at
there.
Cash and Carry in Olympia. They doubled everything on their order, and they're already sold out.
They're already sold out. There is a mass fear factor that's going on about it. But once again, as Dave said, we do not know if it's airborne, we don't know what exactly, like with yours for the opening up letters, is that, we don't know, so you take the precaution of saying, you make sure everything you touch it's contaminated, you just play it that way that it is contaminated.
Well, the treasurer's office is starting to get their tax payments.
Yeah.
We're starting to get, personal property statements in
Right.
the mail. So the volume of mail has increased through all 3 officers. We'll just go buy some books later.
I'll talk to Kelly, and we'll try to figure out if there's somewhere else that we can actually, but once again, this is happening around the entire United States.
Right.
So,
To give you an idea, 3M only has one factory producing the N95 masks,
yeah.
and that's a supply worldwide. So, thinking ahead there, right?
Packaged with air.
Yeah, it's like in Indiana or someplace. We do have, as a county public health, we do have an alternate treatment center. It's basically a hospital in a box. That should things get, really out of hand, we have that we can set up as well. So we have the ability to set up alternative treatment centers. But what we're trying to do, one of our biggest goals is to keep our health providers and our EMTs and firefighters and law enforcement healthy. We have to have those guys, gals, those people out there working to help everybody else. So one of the things we're working on today, and we'll have to shed by the end of the day, is a clear-cut decision from the medical side on what constitutes the right PPE for someone who's working with clients or working with someone who's suspected, so that we don't start quarantining our healthcare people. If they've taken appropriate PPE, masks, gloves, whatever that winds up being, yeah, then they keep them in the system. We're not gonna quarantine them and send them home. We can run out of folks real quick.
Kirkland's running into that, cause they did it that way originally, when they did, they sent everybody home, and it's like, whoa, that was, almost 30% of your staff.
For those people that caused the Mountain View to be cleaned, are they being tested like daily, or are they just waiting for them to show symptoms? The husband and wife, the husband was the EMT and she's a teacher?
I haven't gotten that back from DOH yet.
Okay.
Yeah. One of the problems we have.
Just wondering if they were keeping you informed about.
We get a lag from DOH. So it goes to the lab, then to DOH, and eventually comes to us. So we did tie into that system this morning, so we should be we're sending them our info every day. So we send them a daily sit rep, and we're getting that back as well. Other questions?
Just a statement, we have questions on who's gonna do it. It's us. There's just no way around it. Be prepared for that. And that's to our friends and neighbors that are at home too. On the video, it's up to us, each and every one of us. If you're in doubt, clean it. If somebody comes up to you and you think they may be sick, don't be afraid to say, right now it's best that we keep a distance. If you're not feeling it, don't be afraid to say, right now we need to keep a distance. Stay home. Do us a favor. I know it sucks for all the department heads and everything, but once it starts getting around, it's going to be, touch and go with everybody. So just do us the extra favor of not showing up. Same with me. One thing I hope that we can do, we need to have a certain conversation with having a line that is accessible to the public, that is going 24 hours a day, so that they can have a contact. Currently, we had an issue, so hopefully we'll have that figured out now, and we'll go on. But again, it is up to us, each and every one of us. Try to stay away from the stores on the most part, but go get some stuff to be able to stay home for a while. You may have to. If something happens, you need to have those canned goods and stuff that are in your house. It doesn't hurt you to do it. Just be prepared to stay home. You won't stay home if you're sick if you weren't prepared. You put everybody else at risk. So again, please remember, it's up to us, each and every one of us.
And we are a friendly bunch, but you don't have to handshake.
Yeah.
So you can fist bump, you can just decline, put your hands in your pockets, whatever.
Sharon says elbow bump.
Elbow bumps, yeah, anything, but you don't have to handshake. So social distance and hygiene.
There's also an 800 number that they can
Right.
call after
So
hours.
after hours, so on our website, the top of the website in red are the DOH and CDC numbers. You can contact those at any time. Once we get our first case, we're probably going to stand up and go, all day, probably well into the evenings. If we have more than that, we'll go to around the clock. But right now we're 8 to 5, and we have a number with a recorded message that points people where they need to go, and that's extension 599. So county number, extension 599.
And that's on our county site, so when they call the front office, it'll be in part of that recording.
Right. So what we may do, Commissioner, is we may stick somebody, because we had a lot of calls last night. After hours, we might expand and have those calls directed to one person that we put in public health until evenings.
And if we have a special meeting, we can try to make sure that everything's covered for you.
Right.
So, better to have it than not.
Right. So we're going to have a special meeting tomorrow at when?
2:30.
2:30. Okay. So, any other questions?
What are you gonna do when you leave the room here?
Wash your hands.
There you
Shake
go.
your hand.
Right after you hug everybody goodbye, right?
All right. All right.
Yeah. Ross.
Okay. Thanks, everybody.